are really happy to be here this evening to partner with Vermont AEYC to introduce to you folks Sheehan from the Vermont Health Connect and Maria Gamache, who will talk to us a little bit at the end of the session to give us some information from the Vermont Office of Healthcare Advocates. And I might have said that title wrong, Maria, so when we get to you, please correct me if I did. So just some housekeeping. You folks are all muted. I know you're all pretty professional at this Zoom stuff at this point, but you are all muted, but we really do want to hear your questions. Some of you sent them in ahead of time. Thank you for doing that. We will use the Q&A. Please put questions in the Q&A, and Janet and I are here to monitor the box and to get the questions to Sean if he isn't able to, hasn't already incorporated them into his presentation. So again, we are happy to be here, and I'm happy to hand this over to Janet McLaughlin, the Executive Director of Vermont AEYC.
Great, thank you, Luann. And thanks to all of you for coming. Thanks to Sean and Maria, and also want to make sure to introduce and thank Chani, who supports on administration at the Vermont Association for the Education of Young Children. So together we're the team for tonight's webinar, and we are really excited to have this opportunity to review the changes that are in Vermont's sort of health insurance marketplace as a result of the American Rescue Plan. This topic we know is really important for early childhood educators, especially because so many of you, went quickly back to in-person work last summer, without employer-sponsored health insurance. Last August, Vermont AEYC did a survey of early childhood educators. We had 700 respondents, and of those, nearly 10% were uninsured and another 50% were underinsured. So we know that there's, in addition to what we've known through our own work and our own experiences and our own observations, we did gather some of that data last summer to begin to quantify the issue. So as soon as we realized, how significant these changes were, we wanted to make sure to get that information out to early childhood educators as quickly as we could. And so are really grateful to the Department of Vermont Health Access for putting on this webinar with us. As we're getting started, just two other things to keep in mind that I always have to remind myself, which is one, is just that healthcare is really health insurance is really complicated in the United States, right? And we can want it to be simpler, and there's only it is complicated, right? It's not just a matter of like, do you have health insurance or not, right? There's a whole, there's a number of decisions and a number of variables that play in. And so I know that Sean is, going to do his best to keep things as simple as possible. But ultimately, this is a complicated topic, which is also part of why we've invited the Office of the Healthcare Advocate to join us as well, and are planning to also have a follow-up session with that organization. So just keep that in mind. If you're getting confused, please feel free to ask questions, but also know that sometimes we feel frustrated, and it's just about the system that we have right now, and and so we're trying to be as clear as possible. And the second piece is for this particular webinar is really focused on this from the individual perspective and from like an early educator perspective, as opposed to from an employer perspective for this particular webinar. And so we can, as these, these changes, as these changes, play out over time, we can begin to consider what, what support Vermont AEYC might be able to offer as we think about this from an employer perspective, because we know that there are early childhood education programs who do offer health insurance, or a lot of them that are many programs that are considering it. So there might be a few questions that come up in that today that might be out of scope, but also feel free to ask them, and then we'd know that those are the questions that are out there. So I just want to put those couple of thoughts out there. Really glad to be with you and glad to dive into this topic. So I will turn it now over to Sean from the Department of Vermont Health Access. Thanks, Sean. Oh, Sean, you're still muted, sorry.
Great, apologies for that. Was talking away. I would have talked for an hour and not known. So yeah, thanks Janet for that introduction. Thanks all for having me. Thanks for taking time out of your evening. As Janet referenced, health insurance can be complex. It's probably not the top thing you'd like to be doing on a nice spring, finally get good weather out here, evening, and so we'll do our best, because it is very important and it can save a lot of money, and it's because it is the system we have. So thank you. My name is Sean Sheehan. I'm with the Department of Vermont Health Access, as was referenced. For those who don't know, Department of Vermont Health Access is part of Vermont's Agency of Human Services. We're in state government. We're the department that's the state's Medicaid agency. So we oversee Medicaid for the state, and also the state's health insurance marketplace, Vermont Health Connect, that we'll be talking about here. Let's see, the poll popped into the screen there. I think hopefully folks can see my screen. So it was really helpful to see. I really appreciate both information with the poll and sending the questions ahead. It was good to know there's a lot of people that are members already familiar with the marketplace, other people that have looked before, and the questions are where you're coming from. It's also a challenge, I think, as Janet referenced, to cover all of those things. We probably could have a series of 5 or 6 seminars on different areas, but we'll do our best to cover the most. Number one, the goal I had for tonight was to show you what makes 2021 and 2022 completely different from past years, for people who have looked before or people who are currently members. So we'll be seeing things very different. We'll talk about that. Number two, to help, I think some folks identified in the poll that they were trying to decide between signing up for health insurance and being uninsured. We'll address that. And third, want to make sure you have the tools and resources to choose a plan, learn how to get the most out of your health coverage. We'll talk a little bit about health insurance literacy. We won't have the chance to go way into depth. I apologize. Some of it seems fast now, but I hope to at least point you to some resources to help you kind of refresh on some of the terms. And I won't be quizzing you at the end. We'll wait till after you study up with the resources we give before we quiz you. And if nothing else, if you don't make the whole hour, I don't want to give people an out, but if you do leave or get disconnected, if you come away with anything, would be to ask you to go to vermonthealthconnect.gov, and you'll see a shopping cart, the plan comparison tool. If you're looking on your phone, it'll look like this. If you're looking on a computer, it'll look slightly different. You click on that tool, it'll walk you through both a lot of health insurance literacy and a real estimate of what health insurance options will cost you. If you want to apply, there's also the button there that you can click to apply. You can apply over the computer, and there's also a phone number you can call and apply over the phone. So I know a few questions referenced how to sign up and those things. So try to knock off a couple of questions right off there before I miss them. On the topic of health insurance literacy, if you go to the website at vermonthealthconnect.gov and click in, you'll see a sidebar that looks like this with a login, home, how to apply. And there's a piece called Find Local Help. And under there is a section called Educational Materials, or you can just type educational materials into the search bar. And I think it looked like several people were inquiring not for themselves, but to learn more, to share with their employees or their friends or their family. This is a good place to start. These half dozen documents are PDFs that look nicer than probably my PowerPoint or a lot of bullets. It'll be easier to to stand. A lot of the Health Insurance 101 goes through a lot of these health insurance terms. There were a couple questions people asked about Medicare, or who can sign up for the marketplace, who can get subsidies. That were the yellow arrows pointing to healthcare coverage in Vermont. That's just a half pager, really simple, but it explains the people who are on Medicare, which is either people who are blind or have a disability, or people who are 65 or older qualify for Medicare. And by virtue of having another offer of insurance, such as Medicare, you can't qualify for these subsidies that we'll be talking about tonight. But there is a phone number on that healthcare coverage in Vermont for the senior helpline and some other resources that can help people on Medicare. And there's also information for people who can use the marketplace, people who aren't 65 or blind or disabled or have other coverage. And as we noted here, that you can print a lot of these materials, but we can also mail materials to you as well if you want to put some out for families at your schools or place of work, or for your employees. Having said that, we'll go through a bunch of terms now, try to strike that balance between not using a bunch of terms that people haven't used and not trying to overwhelm you now. Hopefully I won't miss the boat on both counts. You can let me know. One term we'll talk about a lot is qualified health plans. These are the health insurance plans that are sold on the marketplace. And by purchasing a health plan, you can qualify for subsidies, for the premium tax credits we'll talk about to make these plans more affordable. A monthly premium is a term that I think from our polling, it's one of the few insurance terms that people tend to understand well. Part of that is because it's the same as with your similar ideas with your car insurance, home insurance, renter's insurance. It's what you pay each month, the bill you pay each month in order to have the health coverage. So as with your car insurance, you hope not to use it. The premium with health insurance is a little bit better. It comes with free preventive care, and it's good to have those annual checkups. But again, you're hoping you don't get hit by a bus, don't get cancer, don't need a big expensive operation, but it gives you that sense of protection, and that's what you pay the monthly bill for. Now, to differentiate the gross premium, a lot of people had talked about how expensive the premiums are, and if you'd heard in the news some of the price hikes, the premium hikes they talk about each year, that's that quote unquote sticker price. Fortunately, we'll be talking about tonight, almost nobody will have to pay that. People who don't have other offers of insurance won't have to pay that sticker price. What you'll pay is actually a net premium. That's the premium after your financial help. The second type of health insurance costs are your out-of-pocket costs, or cost sharing. So if the premium is what you pay each month, the cost sharing is what you pay when you actually need to use coverage. Again, not the preventive care that's free, but if you had to go see a specialist, if you had a hospital inpatient, various pieces, you would have to pay that. And there's a couple ways that come into play. Health insurance plans have a deductible. Again, that's similar to your car insurance policy. If you had a $500 deductible with car insurance and you get in an accident that would cost a couple $1,000s to repair, you would pay that first $500, and then your insurance would kick in after that. Health insurance is a little bit more complicated than car insurance in a few other stages. So with the deductible, there's some services, there's some prescriptions that are covered even before the deductible with some plans. And after you pay your deductible, you're in a period where you pay part of the costs, and the insurance company would pay part of the cost. That's called copay or co-insurance, up until the point that you reach your maximum out of pocket with a plan. So if a plan has a maximum out of pocket of $5,000, that doesn't include your premium, but it means that after you've hit your deductible, including what you've paid toward your deductible and including what you've paid in any copays, co-insurance, you can't pay more than that amount. So in that example, if you paid $5,000 and then you had to go to the hospital or you needed expensive treatments, prescriptions, whatever the case may be, your insurance company would pick up the entire tab from there on out. But it's good to be aware of maximum out of pocket as kind of that worst case scenario with your financial planning. Covered services and essential health benefits. Some people, I noticed some of the questions asked about what services are covered. And this is one of the pieces that was relatively new with the Affordable Care Act mandated nationally, that a set of 10 essential health benefits ranging from ambulance care to physical therapy to inpatient care, rehabilitative care. There's a whole set of items that are covered by all qualified health plans. And that made, even though health insurance is still complex, it makes it a lot more understandable than where things were 12 years ago before the Affordable Care Act, because you could have some plans that wouldn't cover inpatient or wouldn't cover certain services. And so trying to compare apples to apples was very, very difficult. And covered services just refers to all of these benefits that are covered in your health insurance plan. There were some questions about dental plans too. Dental plans aren't covered in the qualified health plans for adults. There is a benefit for children, but Northeast Delta Dental is a health insurance provider that does sell dental insurance through the marketplace. So if you log on at vermonthealthconnect.gov, or if you call, you can access dental insurance, but it's not subsidized. It doesn't qualify for these, so the federal financial help we'll be talking about today, but you can access it. Again, I mentioned preventive care. Anything that's deemed preventive care doesn't have any of those copays, cost sharing. Total costs is an important term we'll be talking about. That just refers to your premium plus your out-of-pocket costs. So when you're comparing plans, it's easy to kind of get fixated on a premium or on a deductible or some of these terms we know, even the maximum out of pocket. But really think, to the extent you can think about total costs, that's really what matters to folks more, because that's what's leaving your bank account over the course of the year. And we'll talk about different ways in the plan comparison tool to look at those total costs. A metal level is a term for people. It looks like many people already were somewhat familiar with the marketplace, either currently have plans or have looked at them. Metal level refers to 4 levels of plans. There's platinum, gold, silver, and bronze. And people hear platinum, think that's best. I want that. And it's important to make the clarification of what that quote unquote better metal or worse metal stands for. We'll talk about it in a little bit, but really it doesn't have anything to do with what services are covered or the essential health benefits. As I mentioned, all of the qualified health plans have the same benefits. The difference is really whether what you pay is more heavily tilted toward your premium or toward your out-of-pocket costs. A platinum plan, for example, as we'll talk about, generally will have the lowest out-of-pocket costs. So somebody that expects to use a lot of medical care, or somebody that doesn't want to have any risk, may choose that platinum plan because it'll have the lowest out-of-pocket costs, but it will have the highest premium. So if you don't use a lot of medical care, you'll be having a much higher total cost with that platinum plan than you would with a quote unquote lower metal. And the bronze, silver plans would tend to have lower premiums, but you would pay a higher percentage of the cost when you need to use your healthcare. Financial help, we'll be talking about premium tax credits is a big one. That comes from the federal government. It's based on your income, and it lowers the cost of your your premium. Advance payment of premium tax credits. I know there's two P's, but only one P in the acronym. That's one of two ways of taking the premium tax credits. So you get premium tax credits based on the year, based on your anticipated income for the year and the number of months enrolled. And you have the option, if you wanted, you wouldn't have to take any of the premium tax credits up front. You could take it all when you file your taxes at the end of the year, or you could take it all as a discount on your bill. And if you take it as a discount on your monthly bill, it's referred to as APTC. Vermont Premium Assistance is a state-based premium reduction, which augments the federal premium tax credits to make it even more affordable for people who qualify in Vermont. That's a monthly benefit. The second type of financial help doesn't refer to premiums. It refers to that other side of insurance costs that we were just talking about, the cost sharing or the out-of-pocket costs. And cost sharing reductions are also something you can be eligible for based on your income. And what they would do is they would lower your deductible, lower your maximum out-of-pocket costs. And the catch with them is if you qualify for a cost sharing reductions, you have to enroll in a silver plan. But you don't have to enroll in a silver plan, it's just because you qualify. But if you want to take advantage of that benefit, you have to enroll in the silver plan. So we'll talk about this in a bit too. There's various levels of cost sharing reductions, and cost sharing reductions are I'd say definitely the most misunderstood and complex piece of the health insurance marketplace. So we can talk a little bit more and point toward resources there as well. Medicaid and Dr. Dinosaur are another type of health insurance, and they're also sort of another sense of financial help in the sense that people who qualify for Medicaid get their insurance for no premium. With Dr. Dinosaur is for children and pregnant women. Depending on income level, Dr. Dinosaur may have a small premium or not, and has very low copays. Because Vermont's fortunate in one of the ways that we're one of the only states that our Medicaid agency oversees our health insurance marketplace, and we have an integrated application platform. So in a lot of states, you'd have to, if you thought you might qualify for Medicaid, you might apply there and get rejected if you didn't qualify, and then could go to the marketplace and fill out an application there. In Vermont, you only have to fill out one application. If you qualify for Medicaid, you'll be told you do and can be enrolled there. If you don't qualify for Medicaid, you can be told about your financial help to enroll in qualified health plans. One catch, however, is that if you do qualify for Medicaid, you don't have the option of turning that down and enrolling in a qualified health plan and getting benefits. You could pay full cost for a qualified health plan, but you wouldn't be able to get premium tax credits and these other forms of financial help unless your income were to change and you no longer qualified for Medicaid.
Sean, can I ask you a quick question? We had a question come in on the question and answer about pre-existing conditions. And it says the tools don't seem to factor in pre-existing conditions. So do you want to just speak to that? Sean, you do not have a poker face, I have to tell you.
Disappeared.
Did you peer
Not sure how
around?
long I was gone. You could see my poker face.
It seemed quick. Did you hear me that I heard that there was a quick question that somebody was asking about pre-existing conditions?
Oh, okay.
And that doesn't seem to be factored in. And just, could you speak to that quickly?
Sure, absolutely. Yep, that was another piece of the Affordable Care Act, although actually in Vermont had pretty good protections for pre-existing conditions even before the Affordable Care Act. But that's something that people don't have to worry about. If you live in Vermont and you meet the standards of being legally present in Vermont, not being incarcerated, and don't have other offers of coverage, you can enroll through the marketplace, and you can access the benefits. So it is a guarantee issue. There's no consideration of pre-existing conditions. Insurance companies can't turn you down because of a pre-existing condition. They can't charge you more because of a pre-existing condition. We're fortunate in that case. Were there any other questions I missed or other pieces of? Great.
Sean, there is one related to, do I have to go through my employer or can individuals sign up for this?
Great. Yeah, that's an excellent question too. So for people who, I guess the short answer is individuals can sign up. And actually what we're talking about right now with the health insurance marketplace is only for individuals. There is also a small group insurance market that offers these same metal level plans. And so your employer may offer you, your employer may offer Vermont Health Connect plans. And if they do, you can certainly go to the plan comparison tool that I pointed to, and you can still compare plans and see what might be the lowest out-of-pocket costs or lowest total costs. But the important distinction is that if your employer offers you coverage, and we'll talk about this in a little bit too, but this is a point that can't hurt to reiterate. If your employer offers you coverage and that health plan would cost less than 9.83% of your household income for single-only coverage, then the federal government considers that plan to be affordable, and you don't qualify for the premium tax credits that we're talking about now. So this is an important point on a couple of levels. One, I think, for the employees who are wondering about signing up, and also two, there were a few questions from employers, I think, wanting to offer coverage to your employees. And this is something that I think, as Janet or Luann referenced, it can be a different session because it would take a lot of time to talk about all the considerations for employers. But it's important for employers to think about, because if you just offer your employees the right to buy a plan, but it would be kind of expensive, but not too expensive, it could actually be doing them a disservice and obviously costing you more than were you not to offer coverage at all. And so if you don't offer coverage, or if the coverage would be seen as expensive, that's when individuals can come to the marketplace and access these subsidies. Thank you. The other piece here to flag, just kind of we're talking about terms. The Affordable Care Act was big. It's also known as Obamacare, and that was, I guess, 11 years ago now, really put in the marketplaces into effect. There's health insurance marketplaces in every state. Some work off the federal marketplace, a whole bunch work off their own, like Vermont. In Vermont, our marketplace is called Vermont Health Connect. And as I mentioned, it's run by the Department of Vermont Health Access. The insurance issuers are the companies that offer the insurance plans, and you can buy insurance directly from those issuers. And some people did if they thought their income was too high to qualify for financial help. But the only way you can get financial help is if you enroll through Vermont Health Connect, vermonthealthconnect.gov, or the phone number, as we discussed. So that's an important point. And I referenced, some people asked about dental. You can find dental plans again, but they're not access to the subsidies. There's also sister organizations, sometimes called navigator organizations, and certified application counselors. If you go to the website and click on find local help, there'll be a a sister directory. You can find people in your county that can help people enroll and talk about these plans. As referenced before, and as joining us today, we have the Office of the Healthcare Advocate too, who is available if people have problems signing up for coverage or get a determination and challenge their eligibility determination, and it can't be resolved. They're available to help with that as well as just to help understand many of these terms. The other federal law, the American Rescue Plan Act, was just passed in March, and that's what's really different now, and that's what we're going to be talking about. A few people referenced they were trying to decide between whether to sign up for coverage or going uninsured, and I wanted to address this sooner rather than later. The number one point is that with the American Rescue Plan Act, it's really a completely different universe than under the Affordable Care Act. And so don't make any assumptions that, oh, I looked 2 years ago and I saw I got some financial help, but it was still so expensive. You have to look again to see. The other piece is that people have assumed before they didn't qualify for subsidies. Most likely they do now. People who are in single plans and have incomes up to $94,500 will qualify for tax credits, and people in family plans with incomes up to $265,000 can qualify for tax credits. I don't think I need to drive home that point anymore. I don't think there's too many of us or too many of our neighbors with incomes over $250,000. We're not in Silicon Valley. Individuals with incomes up to $38,000 per year, and couples with incomes up to nearly $60,000 per year can qualify for zero premium bronze plans. So this is really the point I wanted to drive home for people who are thinking, oh, I don't know, do I get coverage or do I not get insurance? If you're somebody that knows you want insurance and you're trying to figure out what metal level to go into, we'll get to you in a little bit, and that's a more involved process. But if you're somebody who is wondering, maybe I get insurance, maybe I don't. If you're an individual and you're not making more than $38,000 per year, or a couple making $60,000, you can get a bronze plan with no premium per. Again, you can only access financial help through the marketplace, and we have the plan comparison tool. And I do want to put an asterisk next to the
You back, Sean?
I'm back. I can still see the screen. I'm not sure what.
We can still see the screen. Yes,
Okay.
but we didn't hear
Right.
your asterisk. We just heard you say, I want to give an asterisk, and we
right,
were hanging, waiting for the asterisk.
Put you on the edge of the seat there, right? You can't have the footnote without the footnote, the asterisk there. It's very important here, I think, is that to note that bronze plans can have high out-of-pocket costs. So that's why I think if you're deciding between plans, we'll talk about that. There's definitely some downside to bronze plans. But if you're somebody who is kind of to decide between, do I not have insurance at all, and do I get a bronze plan? Bronze plans might have high out-of-pocket costs, but they're really low out-of-pocket costs compared to not having insurance. If you run up a six-figure hospital bill, having a $7,000 or $8,000 maximum out-of-pocket would seem real low compared to that, and particularly if you don't have any premium. So that's kind of the consideration. If you're thinking about not getting insurance, definitely take a minute, look at the plan comparison tool, look to see what it would cost you to get the most basic level. May well be worth it. The American Rescue Plan I mentioned had some pretty big changes, and some of the questions asked about how long they're in effect for. Right now, most of them are in effect for 2 years, for 2021 and 2022. There's a lot of talk in Congress with the American Families Plan that President Biden's been proposing, includes provisions to make these permanent. but that hasn't passed yet. For now, they're definitely in place for this year and next year. Number one, people who already qualified for subsidies in the past will find they qualify for more financial help now, meaning their plans will cost less. Number two, I mentioned it used to be that big cliff that people would find if they were over an individual making just over $50,000 per year, wouldn't qualify for any financial help. So just under it, you would get thousands of dollars in help per year. Over it, you would get zero. That cliff is gone. It's now a phase out. As a reference, an individual up to nearly $95,000 can get some financial help, or a family plan up to over $250,000. The third provision, anybody that has anyone in their household that's gotten unemployment compensation or qualified for it at any point during 2021 can get even bigger plans. Will have access to getting some silver plans with very low out-of-pocket costs for zero premium or a very low premium. And so that's, I think, very important to help spread the word. If you know anybody that doesn't have health insurance, and if they had any unemployment this year, and that's a big opportunity for them, assuming they don't currently have an offer of insurance. This holiday from tax credit reconciliation, won't spend too much time on. We're a day past the tax filing, but anybody that, if you already did file your taxes and you paid back any premium tax credits that you owed, the IRS will be sending that money back to you. So that's the good news there. And finally, the anybody that has COBRA extended coverage or Viper coverage is the small group version in Vermont. It's anybody that was laid off and offered the opportunity to buy their health insurance from their former employer. It's something that people can often do to make sure they keep insurance, but it's very expensive because you're paying the entire cost. The American Rescue Plan covered 100% of that cost for 6 months through September. And so I bring it up now just because if you know anybody that has COBRA coverage, they can stay on it through September, but they should come check out the marketplace in September before they start having to pay their full cost on October 1st. So they can come to us in September and switch over. One piece.
Sorry, just we've gotten a couple questions about timing, and I know on your last slide you had a prompt about require system updates. So could you speak to that quickly? Yeah, absolutely. So a piece for that is, so it's one thing for Congress to pass a law, or our state house to pass one for that matter, anyone, and it's another thing to actually implement those changes. And so when that law was changed, making these changes in what subsidies people can get, we had to put in in order to change the system around. And so those system updates are going into the computer. What that means is right now we're in a place where if you were to apply for coverage today, you would see the same levels of financial help that you would have seen if you applied during open enrollment in November or December or January, any other time. But if you go to the plan comparison tool on the website, you'll see two versions. One option says after the American Rescue Plan and one before the American Rescue Plan. The before the American Rescue Plan aligns with what you would have seen and what the system is showing now. The after the American Rescue Plan aligns with what the law actually is and what the subsidies will be when those changes go into effect. And those changes will go into effect next month in June. So people who are, it looked like several people were currently members. If you're currently a member, get your insurance through Vermont Health Connect. You don't have to do anything. You'll get a letter in the mail after those changes go into effect, telling you what your new subsidy amounts are and giving you the opportunity to apply that as an additional discount on your bill. It'll also give you the opportunity to change plans if you'd like. Normally, you can only change plans during open enrollment or if you have a certain life event, but you'll be able to do it after those changes go into effect this summer, because somebody who was maybe getting a bronze plan and could now use their additional subsidies to get a silver plan might want to do that. There may be other changes in play as well. So
People who already have coverage don't have to do anything. You'll get noticed when you can do something. People who don't have coverage, you have a couple options. One, you can apply now and you'll come in, you can start if you apply today or in the next couple of weeks, you'll start coverage then ahead for June 1st. You would initially pay what you would have paid earlier in the year, but you will get those additional tax credits, as will everybody who's already been enrolled. So if you were getting $500 per month in financial help in the old system, and in the new system, you'll be getting $1,000 per month. You'll get credit for January through June, or just June if you sign up, but that extra money that you then can apply to potentially get more than $1,000 discount for the subsequent months of the year.
Can I just make sure I just rephrase to just try to make sure I've got it translated right in my head, so that the law makes the tax credits available as of January 1st, but the state systems aren't going to be updated until next month.
That's correct.
So you would get the tax credits retroactively if you're already enrolled, or if you go ahead and get enrolled right now, but you just won't see that right on your bill until July 1st. So the tax credits are sort of in effect
Yep.
from the law's perspective, but not quite yet from the system's perspective. Is that right?
Yeah,
Okay.
that's exactly right. Yeah, and
then,
really, yeah, it'll probably be, I think for most people, August 1st and their August premium when they sign up, because when the changes go into effect in June, people will get noticed. Even if they call in late June, they would have already paid their July bill, and so it would go into effect for the bill they would get in July for their August coverage, most likely.
And then just one other question that was related to the previous slide that says, it's asking about, so it says, can you confirm in September is when people on unemployment can get 100% cost coverage through ARPA, which I think is not quite right, right?
Right.
So,
yeah, that's
okay.
Yeah, that's right. And actually, I hadn't made that connection, but that is a good point. I see with the unemployment, because people who could be on COBRA might have been people that were laid off, but actually the COBRA coverage and the unemployment are two different benefits. COBRA coverage isn't managed by the marketplace. It's managed by your former employer, and the federal government's just picking up the tab. But if you want to leave that in September before you'd have to pay full cost, you'd be able to come over and get subsidies through the marketplace. The other provision that we talked about for people who have any unemployment compensation, whether or not they were offered COBRA or signed up for COBRA, can get that full benefit, and they don't have to wait till September. They'd be able to sign up when the system updates come into play in next month. And people who are already enrolled, so people who are already enrolled in a silver plan but have already reported some unemployment compensation to the marketplace, we have that in our system, and you would automatically go into that silver benefit plan if you're already signed up for a silver plan.
Okay, and great. And I just, thank you, Sean. And I just noticed it's 6:45. So, and I think that we're getting to this exciting part where you can actually, where Sean's got some specific examples for us. And I think the key takeaway for people that either, households that have COBRA or unemployment happening is that they should be in touch with Vermont Health Connect to figure out what the right, for them individually, how this impacts them. And we just wanted to make sure you guys knew about that.
Yeah. That's exactly right. Thank you. Yeah, here, I think just to note, it's often I think Vermont has the reputation of expensive health insurance costs for people whose incomes are too high to qualify for subsidies. Now, as I referenced, now that people qualify for financial help, even at higher income levels, even a family at $150,000 income would be able to get a plan. And so I think with the example we were just talking about, to drive that home, somebody who wasn't getting that subsidy through the marketplace, if they signed up now, it would cost them $1,381 for that plan. Once the changes go into effect, that plan would cost them $562 after that $819 subsidy. They would have that additional $819 tax credits for June that they could apply to make this $562 bill even lower going forward, or they could get it back when when they file their taxes. Or they could wait and sign up and just pay $562 when it's signed up. This was the piece here, showed before the way the plan comparison tool looked on the website. Even if you just have a smartphone, you can still, it'll look like this. This is a screenshot from my smartphone. You can click on that plan comparison tool. There's a little bit of video here. If I was too fast going over all those health insurance terms, you can watch the video, get an introduction. You can just take a minute or two to put in your age and relationship of other people in the household. If you want a more accurate estimate of your likely out-of-pocket costs, you can put in your health status, and if there's any planned medical procedures you think you'll have this year, and it'll estimate based on somebody your age and those health conditions. Or you can, if you just want to go fast, you can leave them blank and get the average. You answer questions about the unemployment benefits and whether people have access to employer coverage. You put in your income. As we referenced, there is an affordability estimator on the website. I mentioned it was 9.83% is what, if you're offered employers 2-month coverage, it would have to be more expensive than 9.83% of your household income. But there's a worksheet to help you with that. And once you click on your income, you'll come to this screen that'll show you what your premium subsidy would be, that premium tax credit and the Vermont premium assistance. So for somebody making $25,000 per year, that would be $662 a month in financial help. It'll also say this Silver 87 piece, which can be, a little confusing. And that's a chart here that I don't want to lose people too much in the chart, but I do want to drive home this point that I think people that need care often think, oh, I want a platinum plan, or I don't want the risk. The one catch to that is if you're back on this screen and you see Silver 87 or you see Silver 94, that actually means you can buy a silver plan, have a lower premium like a silver plan, but what you pay out of pocket would be about the same as a platinum plan, or even less if it's a Silver 94. So the bottom line is, if you qualify for Silver 94 or Silver 87, you see that it's based on your income. It means your income's too high for Medicaid, but lower than some of the other thresholds we're talking about. That's a good way to go. We can't recommend plans. Really going through the plan comparison tool is a good way to study, but really people who qualify for Silver 94 or Silver 87 is a good way to go. People, if they see a Silver 73 or Silver 77 in there, it means you get some benefit from having a silver plan, but you still might find bronze or gold or platinum to be better, depending on the situation. If you don't see Silver 73 or Silver 77, if there's nothing down here, then you may be best steering away from silver. Silver often tends to have a little bit higher premium, good bit higher premium than bronze, and only a little bit higher premium than gold. So people that don't see any silver number there might be better off in a gold plan. But really, you can find that out for yourself here on the plan comparison tool. Up here, there's a number of ways to sort. You can sort by premium, see what those monthly costs would be. As we referenced in this case, people would find that example we just gave, somebody making $25,000, and as I mentioned, an individual up to $38,000 actually, would find 0 premium plans. But you also see that bad year scenario. That's not insignificant. If you have that maximum out of pocket, you could be paying $8,400. So you can go back up to the sort by, switch it to look by cost in an average year. And this is where people would see that really a silver plan may be a better bet. You have to pay something, but there's silver plans for this person making $25,000, so just a few dollars a month, and it's really bringing down that expected average cost and their expected bad year cost. And you can even then sort, if you're somebody that's really risk averse and want to anchor more on getting that lowest worst case scenario rather than the lowest average year scenario, you can sort that way as well. And so again, this person, instead of taking that bronze plan that had 0 premium, but a bad worst case scenario would be paying $8,400. Now their worst case scenario is under $1,500. And again, that's very unlikely, but still something to be aware of. The last piece to note is just if you click on any of these plan names, the blue font there, you can go more in depth, click the red button to enroll. If you have a doctor, you want to make sure they're in network or a provider, you can look, that'll go right to MVP or Blue Cross's site. If there's a prescription you or someone in your household takes, you can click on the drug list, and that'll take you right to there. You can see how the prescription benefit is, what you would pay for that. So there's a lot of opportunity to research more. You can scroll down, and again, not to worry people with that worst case scenario, somebody of that age, 40 years old, only 3% chance of having that worst case scenario, 18% chance that they don't pay anything out of pocket. They're just using preventive care. So lots of information to end on. This is the last slide I had.
Sorry, just one question was about prescription coverage, and the question's asking, are your prescriptions guaranteed to be covered in the new plan? And I'm curious about that, sort of how you would answer that question.
Yeah, so I guess with the question, one kind of clarification on that with the new plan, is that referring to the new plan versus the way things
I guess just if you change from one plan to the other.
Yeah. Right. Yeah, that's so people that change mid-year. I got it. Yep. Yeah. Yeah, that's a great.
Which companies?
Yep. Great question. Yeah. So there's a distinction there between switching plans and switching companies. If you switch companies, or if you switch a plan from the market, say from your employer plan to a COBRA plan or a COBRA plan into the individual market, then your out-of-pocket costs would reset, your deductible would reset, whatever your prescription deductible would also reset. You'd have to pay from start. And if you switch mid-year from Blue Cross to MVP or vice versa, that would also hold true. So that's definitely a word of caution I would raise for people who are looking to change plans, at least mid-year. And maybe, and if you've already had some costs, it may be in your best interest to stay with the same insurance company. But changing from one metal level to a different metal level or one plan design to another, you're safe either staying within MVP or staying within Blue Cross. Both insurance carriers have made the commitment that if people change from, say, a silver plan to a bronze plan to gold, whatever the case may be, and you've already paid, say, $500 toward your deductible and maximum out of pocket, you would get credit for that $500. And the same thing with the prescription benefits, anything you've paid toward that maximum out of pocket as well. Great. Are there other questions? I don't have any other slides. I added this one slide at the end.
There is one quick question, which was, it's very specific. It says, which line on your 1040 is used for your income figure? But,
that's an excellent question too. That probably could have been up on the health insurance literacy terms too. So it's not exactly any one line from your tax forms, but it's very close. And the one that it's closest to would be your adjusted gross income. Just did my taxes this weekend. I should know what line that is, but I don't know the exact line, but it's the line that says adjusted gross income. I guess it's different on the 1040 EZ versus the different 1040. So the adjusted, for most people, that the adjusted gross income is going to be the same as what's used here. What's used here is called the modified adjusted gross income. And there's a few pieces. If you're interested in what they are, we do have a link from our website to a breakdown of what's different between adjusted gross income and modified adjusted gross income. An important distinction too is if you want to get premium tax credits and you're married, you have to plan to file jointly next year. Again, you're getting what you're getting tax credits for right now is based on your anticipated 2021 household income. When you file your taxes next January or April 15th or May 17th, if they give us another extension, that's when it'll be trued up, and you have to have married filed jointly to get those tax credits. But again, it would be your modified adjusted gross income. Are there any other questions? Or?
I don't see other questions. So if you want to finish on that slide, and then I also do want to make sure we give Maria 2 minutes just to introduce what the Office of the Health Advocate does.
Great. Yeah, so we can jump right to Maria. Just to flag here, there was some good news this week that came out that as far as employers, I think for the employers asking, and like we said, giving it short shrift here, he'll have a longer session. I'm happy to help, but there is some good news that Vermont got permission last week to unmerge its small group and individual markets. What that means is that they had been the same premiums before for people in small group as well as people that weren't getting subsidies as individuals. For 2022, the small group premiums will be lower, and the unsubsidized individual premiums will be higher. The small group plans people tend to be healthier. So really effectively, small groups have been effectively subsidizing the individual market and rates for the last 8 years. Now, because people with those higher incomes are qualifying for subsidies, the administration and the legislature wanted to help alleviate some of that pressure, make plans more affordable for small businesses. So small group premiums will be lower. The bad news is they won't be nearly as low as these subsidized plans we've been talking about. And as we referenced, if you offer your employees health coverage and it would be deemed affordable for them, even though that quote unquote affordable coverage would cost them a whole lot more than if they weren't offered coverage and could get subsidies, they can't get it. So it's a complex decision, and we're happy to help talk more with employers and can bring in folks from the Department of Financial Regulation and others to talk about that. But I wanted to at least leave on that point.
Okay, and sorry, Sean, I realized there was one more question in the chat, and I think it's a good one, because somebody is anticipating having a 2-month gap in insurance this summer. And so the question is, right, should she, apply for this even though it's for 2 months? And, should she wait until June 1st to apply, or should she reach out right away? Should she be doing this before the gap starts?
Yeah, and those are great questions. They're personal questions. Kind of can't tell people what to do. Certainly would advise that any gap in coverage is a potential risk. And so by calling and signing up now, you get that peace of mind of not having that risk. And if you can afford, if your cash flow allows you to sign up now for June coverage based on the rates and financial help that's available to you now, knowing that you'll get additional financial help for June and retroactively to have lower bills going forward, then signing up now would be a great way to go. But everyone's situation is different. I can't tell.
Yeah, no, so exactly. So I think everyone's situation is different, and I do think that the key is that folks should really, it is Vermont Health Connect, and the folks that work for Vermont Health Connect are the folks that can help advise on the real specifics of what people are eligible for and what's possible for them.
Yeah. Yep. Absolutely. Yeah. I think the big takeaway is just look now, and if you can get in, great. And if you can't, just remember that it's going to look a lot different next month. So don't write it off forever. If you have to write it off, just write it off for a month and come back next month.
Okay, great. And then Maria, we invited you here because in the process, as Luann and I were researching this, as we heard about these changes, we had reached out to Vermont Health Connect, and we also reached out to your office, and we felt like we were really interested in learning about the Office of the Healthcare Advocate. So we just wanted this group to hear just quickly about the work that you do, your organization does, And then we're going to have a longer session with members of with your colleagues later in June. So.
Absolutely. Well, thanks so much, Sean. That was a great presentation, and thank you to our facilitators, Janet and Luann and Chani. The Office of the Healthcare Advocate is housed within Vermont Legal Aid, and it's a nonprofit law firm. And what we do, we're a group of roughly 8 to 10 people, 8 paralegals and 2 or 1 staff attorney on the group. And we can help folks with any sort of problems related to healthcare. And there's no income eligibility associated with it, and it's a free resource. And the way to contact us is through our helpline or through an online intake form. And it's a really superb resource for things that if your insurance company, I won't get into the details because actually, there's like a plethora of scenarios that can come up within the healthcare landscape, which we're all unfortunately very, that happens. So yeah, that's my group, and we're here to help.
So I went ahead and put the phone number and into the chat, and make sure we are following up with folks. We'll make sure we get you guys this information on the Office of the Healthcare Advocate as well. Okay, well, it is 7:03. We really appreciate everybody's time, especially Sean and Maria for coming and sharing this information with us. And of course, we appreciate all the early educators who joined us to learn for themselves, for their colleagues, for their employees, for their family members about this opportunity, because we know, your health is directly related to the quality of care we're able to provide kids. And so we think this is, an important topic for us to keep digging into. So we really appreciate it. So
happy to be here.
Okay.
Great. Yeah, thanks for having us, and thanks for all the work you do for Vermont's kids. It's really important work, and we're happy to help it all here, both with your coverage. And it was really really heartening, I think, to see the number of people on the poll who said they were here to learn, to help spread the word, because this is something we really want to get the word out about. There's a lot of money out there to help Vermonters get health insurance. We're fortunate to have the second lowest uninsured rate in the country, but still the people that don't have insurance, we want them to give it a second look this summer. And so thanks so much for getting the word out. And if you look at those materials we posted and you have feedback on them, or other things that we don't have that would be helpful, please give a shout, and we're happy to do what we can to support you in spreading the word.
Excellent. Okay. Thank you guys so much. And I think as we close this poll, there will be close the call, there will be a survey that pops up, and we love your feedback to us improve for future calls. So thanks so much, everybody. Have a good night.
Thanks, everyone. Good night.
Thank you.